Hi, I'm Dr. John Fogarty. I'm the Medical Director of the Physicians East Sleep Disorders Center. Today I'd like to discuss therapies for obstructive sleep apnea in adults. Sleep apnea involves a collapse of the upper airway, and so treatments are directed at alleviating that upper airway collapse or obstruction. There are a number of different therapies available, and the choice really depends on the severity of apnea as well as patient preferences. So from a sleep study, we determine if there's mild or moderate or severe apnea, and then based on that, come up with a treatment plan. We've seen a lot more apnea in the last 10, 15 years, and part of that relates to overall population weight gain. And so we also, with that, see that weight loss results in alleviation of apnea, so we never want to forget that as one thing in our toolbox, as something to utilize. And it's not an out-of-control amount of weight loss that can help. So 10% of body weight, say 20 pounds in someone who weighs 200 pounds, can make a big difference in apnea. But beyond that, then, we get into different tools that are utilized to correct obstructive sleep apnea. I'd like to review some of these. In mild obstructive sleep apnea, one thing we've utilized for many years are dental appliances, and specifically what's called a mandibular advancement appliance. And these are generally crafted by a dentist who will create molds around the teeth, and then the device is created by using some steel rods. And at night, a patient would insert this into their mouth. It results in advancement of the jaw, and with that mandibular or jaw advancement, people have elimination of snoring, apneas, and generally alleviation of their fatigue during the day. Another treatment in mild apnea would be use of a fairly new device called Provent therapy. Provent therapy utilizes adhesive bandages, and these bandages are placed essentially on the nasal passages, and they have a valve in them, and these valves open up during inhalation. So when we breathe in, the valve opens, fills our airway, our upper airway, with air and pressure. When we breathe out, that valve closes, so the air remains in our airway and helps to maintain airway patency and lessen collapse. And we see this valuable in heavy snoring and mild apnea as well. When apnea is more severe, we generally go to the primary therapy of moderate and severe apnea, which is CPAP therapy. Those letters, CPAP, stand for continuous positive airway pressure. The idea of treating this would be to eliminate airway obstructions, disruptions of sleep, and in the long term avoid problems with tiredness, fatigue, circulatory, and even neurologic problems that can occur. There's two parts to using CPAP. One is called the interface device, or a mask, and the second is a compressor device. A typical mask, this would be called nasal pillows, and they fit in the nostrils. It's a soft plastic with some headgear to hold that in place, and it's attached by a hose to the compressor device. And there's a lot of different types of masks that can be utilized. Some people prefer a nasal mask that covers the nose rather than being in the nostrils. And other people, if they're having difficulty with nasal obstruction, utilize a full face mask, as it's called, that covers the nose and mouth and lets air vent in through both the nose and mouth, and that can be very helpful for some people as well. Any one of those devices would be connected to an air compressor. This is the actual CPAP unit. There's lots of different ones, and it's a pretty big industry, but a lot of things that, with bells and whistles, that can help to help us tolerate that pressure a little bit more. A couple problems could come up with CPAP. One relates to mask issues. So it's important in the initial trying out phase to have some time spent with fitting of that mask. A second problem can relate to sinus obstruction. So if the sinuses are blocked up, we can't get any air through there. We frequently treat things like allergic rhinitis with either non-sedating antihistamines or nasal steroids. And sometimes, if that doesn't work, we'll look further and find nasal polyps or deviated septum. And our ENT colleagues will often correct that through surgical procedures. The CPAP seems to be the most time-tested therapy, the one that long-term seems to show the most benefits. When done right, I think it can work in about 80% of people, but it's not for everybody. In a search for other things that can work, especially a one-time fix, We've utilized surgical techniques. The most frequently done surgery for sleep apnea would be called uvulopalato-pharyngoplasty, and this involves elimination of some of the tissues in the back of the throat, the top of the palate, the uvula, and a tightening of tissues. Unfortunately, this doesn't completely alleviate apnea in most people, so we don't start with surgery as a tool. A more extreme version of surgery would be a tracheostomy tube placement, so bypass the upper airway and place a tube in the lower part of the throat. That's a fairly extreme surgery that we save for very extreme cases or people with other medical problems. One other surgery that's utilized in apnea is back to the idea of weight loss and gastric bypass surgery. For people that lose, say, 100 pounds, about half of them have complete elimination of apnea. A few other treatments have been tried. People have had a lot of attempts at medications to alleviate apnea, but today there are no medicines that have been identified that eliminate obstructive sleep apnea. Other therapy, we talked about alleviation of sinus obstruction, which can help. People have utilized or tried physical therapy for throat and tongue muscles, but this only gets about a 20 or 30% advantage and is not used very much as a therapy currently. One thing in trials is a different surgical technique called glottic stimulation. This generally involves insertion of an electrode deep in the throat. That's done under general anesthesia. Also attached to this is a pressure sensor that can tell when we breathe in and out. And so when we go to sleep, we activate the device, and it stimulates muscles of the airway to tense up with breathing in and hopefully keep the airway open. So it hasn't been determined yet whether this will become a regularly used therapy or available therapy for apnea. So crucial in all of this, I think, is a qualified provider to help you, a qualified sleep center. I think if this is done under the guidance of people with training in sleep, people with training in mask fitting, the actual polysomnographers that do this, as well as working through issues of nasal obstruction and attention to patient preference. I think that gives the greatest outcomes in the CPAP therapies, also making available these other therapies that are available for treating mild apnea as well. Thank you for listening.